Hello, my name is Jeremy Sekovic. I'm going to be discussing this final topic for Nursing 447. It is Crisis the Coming Age, Childhood Obesity. What is childhood obesity? Childhood obesity is defined as a child is defined as affected by obesity if the body mass index for age percentile is greater than 95%. A child is defined as overweight if the BMI for age is greater than 85% and less than 95%. So, according to the CDC in 2014, childhood obesity is a crisis in the United States. Children nowadays are more likely to be obese than any other time in history. According to the CDC, obesity affects 1 in 5 young people aged 6 to 19 years old in the United States. As you can see on this graph dating from 1963 until 2018, the percent of children being obese was anywhere from 5 to about 8%. Now, you look at it, chances are anywhere from 5 to almost 25%. That is a great increase. Why is this? What causes this? Well, it's a vicious cycle. So you begin with a healthy child. Um, then you add in high fat foods such as fast foods, video games, phones, all study, no action. You get mildly obese. You start inhibiting movement with all this, they become moderately. Exercise becomes uncomfortable, and so on. It becomes a vicious cycle. So, what causes childhood obesity? Well, biological reasons, comorbidities, genetics, metabolism, stuff. Some of that we can't control, some we can. Stress and depression. The kids nowadays are facing probably 10 times the amount of stress we ever did as kids. Not to mention, since COVID, the depression rate among youth has skyrocketed. Psychological. Eating behaviors, activities, health knowledge, on physiological, that all affects it. Kids nowadays don't know about healthy eating. We don't sit around the tables like we used to and have healthy meals. It's fast and go. Kids are not as active as they used to be. Phones and video games have caused that. Social issues, social economical status, food policy, neighborhoods and schools. Um, Everybody's affected right now by the increase in price of food. Um, Meals are not what they used to be because of this. People can't afford it. Economical statuses have changed. And schools meals have changed. They used to be fresh prepared food. Now it's food out of a can. And psychosocial issue, culture and gender. It just depends where they grow up, a lot of it. So that all affects it. What are the effects of childhood obesity? Well, here's just a few, but first one will be type 2 diabetes. We have seen an increase in type 2 diabetes among young people because of the childhood obesity. They are developing high cholesterol, high blood pressure at younger and younger ages. We are seeing joint pain and breathing problems. Asthma has been rising. Some of this is because of air quality, but a lot of this has to do with just the fact that children are not physically safe like they used to be. They are having joint pain more because they are putting more stress on their joints at a younger age. You're seeing kids, 18, 19, 20-year-olds, whose knees are completely shot, not because they were doing sports or anything, but because they're overweight. And then you're going to have non-alcoholic fatty liver disease. This has been increasing here in recent years among youth. This is something you should see in older adults, but we are seeing it amongst youth. How can we prevent it? Well, here's a couple ways. Diet therapy is a good one. By doing diet therapy, we are able to help control what we intake, what we eat, That will help prevent it. Physical activity. We've got to get kids out of the house more. They got to be more active. Behavior modifications. We need to teach kids about how to cook a healthy meal, how not to eat fast food because it's there, not to drink the energy drinks. The last one is surgery. Bariatric surgery is a last means resort. This is for the kids that have tried everything else and they can't get their aid off for some reason. Then surgery would be the option. So some nursing interventions we have are listed. An estimate, and these can go from us, hospital visits, or school nurses. Assessment on nutritional status. We need to know what they're eating, see what they're eating, and then we can develop a plan. We need to guide the youth on a healthy lifestyle. We need to give them teaching materials. We need to have class sessions like we used to have growing up when the school nurse would come in and talk about not using drugs or healthy eating. Request for tests. We need to tell the doctor what we think and see if we can get a test. See if we got something biological going on. We need to identify these risk factors and comorbidities more recently. We're not identifying it quick enough. I think, oh, it could be something else. If we can identify this at a quicker rate, prevention stands a greater chance of happening. And we need to refer to other professionals when needed. School nurses need to be watching, and if they see we got a problem going on, they need to talk to the parents. Need to send a note home to go to the doctor. Get this addressed so we can prevent it in the future. So wrapping up, here are the points of this slide. Childhood obesity is a crisis. We know this, we see this, I identified this in the slides. Many factors contribute to this. I identified many other factors. Those are but just the top. There's many more that could probably affect this. Future health problems from childhood obesity. We are dealing with a coming avalanche. If we don't address it now, the health problems we see in the future could very likely overload the healthcare system, and we won't be able to deal with it. There are ways to prevent it. Those are just some of the ways I pointed out. There are many other ways to prevent this. A recent one that just came to mind is Robert F. Kennedy as the head of Department of Health and Food, and him cleaning up what's in our food, the chemicals that we use. That's a recent trend that we're looking at. What we as nurses can do to identify and help the child with obesity. Us nurses, school nurses, hospitals, clinics, we are the front lines. We will see these patients first. It is very important that we identify what we can do and identify what is going on so we can help make suggestions to the doctor to get this corrected and possibly prevent more children from suffering from this. These are my references. I'd like to thank you for listening and thank you all for being my classmates.